Anybody else on the call?
This is Ron, Debbie.
Okay, great, Ron. I'm not sure about Joseph. I texted him a little bit ago, and he's at some kind of governor's meeting. So he said he'll try to call in. And Cynthia LeCount or one of her staff is supposed to be calling in about 12:15. There's a lot of echoes. I don't know if everyone's on speaker. We just need to limit the background noise. Anybody else on the call?
Hi, this is Teresa Holt from the Ombudsman's Office in Alaska.
Very nice. Very nice. Thank you, Teresa.
Hey, Debbie, it's Blythe.
Oh, Blythe. Good. I'm so glad you're on the call. I sent you an email, right? Tell me I sent you an email.
About this meeting or about something else?
Yeah. Well, just about some follow-up from the last time we connected. Did I?
Was that recent?
Okay. You know what? I've had so many things going on, and you were on my list to contact, and I hope I did send that email, but maybe not. All right. I've got Ron. I've got Ina, who works with Tammy at Morningstar. Okay. I'm typing as we go. I've got Dr. Winchester, Blythe Winchester. Who else was on the call? Teresa Holt from Alaska. Ombudsman. Anybody else?
Jonathan's here.
Oh, Jonathan, great. I just sent Julie a few more pictures for the October newsletter.
Okay.
Jonathan, what?
Go ahead.
Your name is Than, right?
Yes, that's correct.
Okay, great. Okay. Great.
Julie's going to join us, but she'll be joining a little later.
Okay, great. Anyone else? I've got Blythe, Ron, Ina, Teresa, Jonathan, and Debbie. Anybody else on the call?
Shannon?
Shannon?
Yeah.
Okay. Okay. Shannon, you were at the annual meeting, correct?
No.
Oh, okay. Oh, that was Valerie. I'm thinking Valerie. Can you remind me your last name again?
Fantasy with Carl T. Curtis.
Oh, okay. How nice. Oh, wow. I am so glad you're on the call. That's awesome. Okay, great.
Janet, Ron Ross, you.
Hi, Ron.
Do you all know each other? Do you know Ron?
No, I haven't got a chance to meet him yet.
Are you the administrator?
I'm deputy administrator. I got one more test to pass, and I passed one of the tests and not the other, so can't.
Okay. Okay. Well, that's wonderful. I remember last time we talked, and you were getting ready to take one of your tests, right?
Yeah.
Well, we are very happy that you are on this call today. That's wonderful.
Thank you.
Okay, I'm putting this all down right now. Deputy Administrator. It's SOCI, correct?
Yeah, SAUNSOCI.
Right, and you're in, yeah, okay. All righty, excellent. Anyone else on the call?
Nope, there's nobody else here.
We are expecting Cynthia LeCount or one of her staff to be on the call. I told them about 12:15, so we had time. The call is being recorded, and we are. This is our monthly meeting, so it's always the third Thursday of the month at noon Arizona time. It's either 2 or 3 Eastern time. So in November it'll change to 2 o'clock, I believe, Eastern time. So we're just going to follow our standing agenda. We'll move through it quickly, but everyone should have a chance to share what's happening in their world. We've got our current facility directory, which there's a few updated items there, which I have did send that, Jonathan, to Julie with a few things I noticed that were not correct. One of the changes, in case you have not heard, is that I am no longer employed at Archie Hendricks Senior Skilled Nursing Facility. So I am seeking full-time employment right now. However, I will be staying involved with the U.N.I.T.E Collaborative. And so I'm very proud of this collaborative and what's happening here. And I will continue to provide some leadership for it along with Tammy Reed at Morningstar Care Center. So are there any new members? I don't think so. I think we've all been on the calls at least once. Anyone have any changes in contact information that we need to know about?
Just you.
Okay.
We need your contact information.
Okay.
Debbie, I'm on.
Good, excellent. I'm going to let you talk first then because I know you're busy. So I'm now, this is my new email, is D, down for Debbie, J, my middle name, which is Jean, Dijak. So D, Dijak at gmail.com. So DJD and then the last name Dijak at gmail.com. There's no dot, any of that.
Can you just send like an email to the group or whatever so we have it?
Sure. Yeah,
All
I
right.
can definitely do that. You know what? Yeah, Jonathan, can you put that in the newsletter too that's coming out in October? Can you just remember to put that in? So remember the deadline for the newsletter. Thank you. The newsletter deadline is always the first Wednesday of the month, so that's coming up. I hate to say it, in 2 weeks, less than 2 weeks. And then we'll have our steering call, and then that following, the newsletter comes out right before the week. When does the newsletter come out, Jonathan? It's the Wednesday. It's the second week of the month, right?
Yeah, that's correct.
Yeah, okay. So we'll have the newsletter deadline is the first Wednesday of the month. Then we have our steering committee the second Monday of the month, and that same week is when the newsletter comes out. And then the third week is when we have this call every month. So we did decide at our steering committee call on the 10th, which was a week ago Monday, we did decide because of what we're trying to do, and I'll go over that a little bit later, that we're going to hold an extra steering committee meeting every month. So we're going to do the second and the fourth, and we're going to try to keep it to 30 minutes and get a lot of work done in between so that we really can just use those calls to kind of report out and get feedback. So that's kind of the plan moving forward. Okay, so I'm going to let Cynthia LeCount talk. She was we had our annual meeting at the Title VI conference, and she has some good news for us about some things that are happening.
Hello, everybody. It's good to see you all on the phone. I guess that's how we say it. But it's always good to talk to other folks so that you guys keep me grounded here in my little ivory tower. I have come up with, sometimes I just amaze me. Other times I amaze me too, but not so positively. But this one I'm pretty excited about. I was driving, there's a lot of miles between Washington, D.C. and my home in Montana. And I drive home about 3 or 4 times a year, so that gives me about 28 hours of driving time each direction. And one day I was driving and I was thinking about long-term services and support. I just had a conversation with John Johns and Bruce Fink, my buddies. And we were talking about this MOU that we have between ACL and IHS and CMS, our memo around long-term services and supports, which is what supports all of these conversations. And a few years ago, right after the Indian Healthcare Improvement Act was passed, which included, of course, the allowance for tribes to develop LTSS services with IHS money that didn't give us any money to do that, we've kind of been struggling in our roles, John and Bruce and I, in our roles as T and TA providers around LTSS because there was no money and there was no grants, and it's kind of like, well, we know we need to do this and we know we need to do that, but as far as funding it, I don't know, and we'd all kind of stumble through a response. Well, then I started thinking about how I believe first I was thinking about the complexities of even billing Medicaid for home and community-based services or in working with Medicaid. And that's when CMS was changing our status or trying to decide if we were Indians or a government or white guys or who we are. And I started thinking that maybe what we need to do is to provide more, and I don't want to say hand-holding, but more navigation kind of opportunities for tribes. And maybe that's part of our problem with us, and when I'm talking tribes, I always forget I'm a Fed, so I group myself with you guys and say us. But I was thinking about, maybe that's part of the reason why we're not advancing a lot in long-term services and support. Definitely because of funding, but also because some of us don't know how to walk that world. This is a very complex world you folks are a part of. And so the idea flashed in my little pea brain that maybe we need to develop a resource center or resource centers with an S preferably, that could serve as not only typical resource centers with providing information and training and technical assistance, but we could also employ, and for lack of a better term, navigators. And these navigators would be available to walk a tribe through the process of establishing long-term services and supports. And I envisioned, the LeCount tribe calls me up here at ACL, and they want to develop long-term services and supports, but they don't know anything about it. They don't know what level. They haven't done a needs assessment. They haven't done any of the pre-work. The tribal council just met, and they decided that's what they need. So after they call me, I would then refer them and call this resource center, who would assign a navigator to start the entire process with the tribes. So it would be, have you done a needs assessment on your elders? We just happen to have one here that U.N.I.T.E has done for the past 20 years. Let's hook you into that. We could do, I was calling it a feasibility study, and I got my hand slapped and said, that's not a really good term anymore. So we're going to call it something other than a feasibility study. But so we would also help them with that step so that they can look at not only the needs of the elders that the elders have identified, but also the community needs and whether or not, what you guys all know, what's available in outside communities, what can the tribe support, is billing an option, et cetera, et cetera. And so this navigator would take the tribe through each of these steps, wait patiently for the results, and we would try and keep this as much within our established network, all of these helpers. And then after we have done the feasibility study, we've got the needs assessment. Now we're ready to start going back to the tribal council and talking about what our options are and what's already available in the area. And literally walking the tribe through this entire process, including seeking funds. And in my first thoughts, it was from the time the tribe makes the initial phone call asking for help until the end result is we're going to buy them a gold-plated shovel with a bow on it, and they're going to dig for their nursing home or their daycare or assisted living, whatever they're going to develop. With this process, I know this is a really timely process I'm describing, so I know we could work with multiple tribes during the process, get them started, because everybody's going to be at different levels. But I think this is going to be kind of a slow, we're not going to tally up a bunch of numbers here, and we don't want to. But as we're helping each tribe through this process, we can also develop a toolkit tracking our steps so that toolkit would also be available, and maybe that toolkit then become a part of our resource center that our website that Jonathan and KAI maintains for us. So when I presented this, I pulled a group together one evening during my conference last month, and we talked about this and came up with all kinds of really good ideas. One of the first things that I quickly understood was, yeah, we want one of these resource centers, but we really want 3 of them at least, because we've got, as you guys know, we've got a huge population of natives in Alaska and Title VI programs in Alaska, and I'm kind of just guessing that maybe establishing long-term services and supports in Alaska is going to be different than it is in North Dakota. And then Hawaii was also there. We have resource centers at the University of North Dakota, in Anchorage, Alaska, and at the University of Hawaii. So Hawaii was also there and expressed their desire and their need to have one that's based out of Hawaii as well. And again, because Cynthia LeCount, living in Bainville, Montana, probably doesn't know how to build a nursing home on Oahu. So after the discussions, folks were very, very supportive. It was a great meeting and great conversations that evening. And folks were very, very, very supportive. And I left with all kinds of good notes and thinking, this is something we really can do. So, and we really can. Now here comes part 2. But before I go into part 2, what's your thoughts? What you thinking, everybody? Is this pie in the sky, or am I making sense? Is anybody there?
Well, I was at the meeting, Cynthia. There was a lot of energy. There were, a lot of people contributing to the conversation. I think, there were some comments that I spoke up, about, tribal nursing homes, and we've talked as a collaborative too, about maybe kind of rebranding ourselves a little bit. So, that it's a very positive thing, that it's a very, it's not like we talked about at our annual meeting, that nursing homes aren't a place where you go and die. They're a place where you live and you thrive. And so we want to keep that. We want to keep that, that whole theme of centers of excellence, best practices. We're here to make your life better, right? It's all about quality of life, quality of care. We want to make your life better. We don't want to make your life worse. We don't want to re-traumatize you. So all these pieces need to go into this, resource center. So it's somewhat about what, Ron does with, the nuts and bolts of getting it all started. But it's also about education. It's also about best practices. It's also about setting it up for success and setting it up for, something really beautiful that's going to last and be, something that, grandchildren can look at and go, wow, that's incredible. We want something good.
Thank you, Debbie. Any other comments, anyone?
I was just going to say, this is Blythe, sorry. I have kind of sent some information to Debbie previously, because within Indian Health Services, the Office of Public Health Support, they're interested in also kind of having assistance for communities in terms of developing this process and what do you need for long-term, services and supports. Where do you go to? How do you decide? How do you do a needs assessment? Just all of the different pieces. And I had mentioned, that I didn't know if we'd ever gathered information from our different facilities about their creation stories and that sort of thing. So I think all this kind of fits together in what we're all trying to provide for everyone in terms of, being that center of excellence and having those resources, for people. So I agree that it's needed, and if we can figure out a way to kind of pool our information and efforts on this, I think it'd be really helpful.
Thank
I like what you just said about our creation story. I love that. That's very, very good. That whole idea of how did we get started, that you're learning from each other. I think that's really good, Blythe. And I did bring up the things that you had talked about. I did bring it up at our annual meeting, and everyone there was fine with, the request that you were making. So.
Oh, okay.
Yep, we did talk about that at our annual meeting. I just didn't get back to you. I apologize.
No, that's fine. Thank you.
And maybe these creation stories, in looking at long-term services and you guys establishing yourselves, maybe these creation stories are something that we could help support through our TNTA contract for Title VI.
Oh, yeah.
Oh, by the way, I didn't mention when I introduced myself that I have Leslie Green on the phone with me. Leslie Green is now working in my office as my deputy director. So I want everybody to meet Leslie.
Hi, Leslie.
Leslie has been with ACL for 14 years and had worked with Title VI previously. So she remembers a lot of you and certainly what we're doing. Okay, now I want to tell you about part 2. Are you ready for part 2? Part 2 is even more exciting than part 1. The end of part 1 was that we said, yeah, okay, we really like this idea and we're going to work hard and maybe ACL can put in some base funds and then maybe we could tap IHS or CMS or HUD or AARP or one of God's angels or somebody to help us support it. So that's kind of how we left. Well, then our good friends in Congress, it appears that, is everybody chuckling with me?
Yeah, we're
good. Here going. In the 2019 congressional appropriation is included a $1 million increase for Title VI Part A and a $500,000 increase for Part C, which is our caregiver money. I know it. And this is our 3rd year in a row for getting increases. So those of you who are helping us by talking to tribal leadership and congressional folks, thank you. But I trotted in and talked to Edwin Walker, who's my boss here, and he agreed that I can take about $250,000 of this to start a resource center for long-term services.
nice.
So, Cecilia and Leslie are developing our program planning memos and all the hullabaloo that you got to go through as a FIT to transfer money around. And then we're going to start putting this idea together. I would like to restrict eligibility. I don't want to, and this is such a bad thing for me to say, so don't record me. And if you ever tell me I said this, I'm going to disagree.
It's called recorded.
I really don't want to open up our world to a bunch of people to apply who really don't know tribes or know the needs or know us. So I'm thinking of how we can restrict it definitely to Indian tribes or tribal organizations, possibly to those agencies or those entities that are already a national aging organization in some capacity, blah, blah, blah. I'm up for recommendations from you guys. But the good news is that in about less than a year, we will be putting a notice of funding on the streets for this resource center. Well, how about them apples? And then I will.
Like in 6 months already to get started.
Oh yeah, yeah.
What was the thinking? I know Leslie's on the call. We at the meeting we had in August, we talked a little bit about virtual, but then some people were thinking it should be a little more people, not so virtual. What was the thinking on that? What did we?
We talked about that just because of travel and distance between all of us. And I'm really open to you guys' recommendations. I've come up with the idea, and I have found that we can put in some base funding. But all those particulars are going to be up for discussion, and I need you folks to help me develop a model that is going to work like we want it to. I'm just very proud of myself. I'm very excited that I've learned here in my ivory tower position that if I have an idea like this, I can actually make it happen. So that's pretty exciting.
Well, that's because you connect with people so well. You know, one thing, Cynthia, I'm thinking. I mean, this is just my thought from what I've done in the past. If you're going to help someone, it helps to at least at one time go to where they are. It's hard to work with people virtually, and it is collaborative. It's a good example. If you've never actually shook hands with a person, met them, saw the work, oh, this is where you sit, this is your desk, these are the people you serve, I think there needs to be some kind of initial point of contact. I really think that's important.
I agree with you. I absolutely agree with you. And I envision, and I'm going back in time here. I had another life, you folks, as a tribal chairwoman for my tribe. And while I was in that position, we got money from HRSA for a Blythe, what are they called? The rural healthcare facilities that are so competitive. Is that what they are, Blythe?
You talking about the HRSA, like yeah, that's what you're talking about. Those rural areas for underserved that qualify for funding and loan repayment and stuff.
Yeah, well, we were accepted into that program at Trenton Indian Service Area in North Dakota, and we're a tiny little clinic, and we were comparing ourselves size-wise to Coeur d'Alene tribe. Coeur d'Alene had already gotten these funds for years and had an amazing facility and services established, and we were the brand new babies in the little crib here. So, but I watched our community as we were planning that and as we unveiled it. And to make a long story really short, there was a lot of disgruntled community members who didn't want to have to serve white people and refused to let us accept that money. So the money was sent back to HRSA. But that taught me the importance, and we used the University of North Dakota for our feasibility study. But there was... the person that was helping us really needed to come to our community for some community meetings because I was too close to the fire for folks to really listen to my logic sometimes. So I think having that third party there, that fifth party or whatever number they are, who can help explain to the community what we're looking at and be that facilitator. I agree, Debbie. I think on-site is critical for a lot of this.
Right, because that's a good example.
Like I said, if we're only going to work with a half a dozen tribes in a year, hey, that's a half a dozen tribes that we haven't helped establish anything before, and we're still doing the toolkit at the same time. I'm happy with that. So I really want to think practical, hands-on.
Do you think, Cynthia, moving forward, there will be more funding with the pattern you're seeing? I mean,
I do. I have already talked to one of our large national partners who is funding our urban needs assessment, and they're interested in dumping some money into this as well. So I think we're marketable. And the end result, I want to have one in Alaska, one in Hawaii, and some here in the state. But I'm pretty excited, folks.
Yeah.
We would never know that, Cynthia. We would never know.
This even woke me up. I was about falling asleep in my chair an hour ago. Thank God didn't set up this meeting to wake me up.
This is the enthusiasm that we need. All of us need to have this level of excitement about what we can do and what's happening. It's one little thing every day, one little phone call, one email that can really make a difference. If you have 10 people forwarding one email, that it just snowballs. It's snowballing in the right direction. We need it snowballing in the right direction, right?
And there's nothing I like better than networking and collaborating. This is just absolutely my cup of tea here. So we're going to be successful in this endeavor.
So I have a question. Is the resource just for nursing homes, or could it be for assisted living or?
I'm thinking any level of long-term services and supports.
Awesome.
Because
awesome.
if we have nothing and our feasibility study says we don't need nursing care, but we need assisted living, that's still a huge hurdle to crawl over. And the importance of having U.N.I.T.E involved in these discussions, you all know how big that is. And Edwin is also long ago in the days of Title VI, we used to have a federal interagency task force, which is just exactly what it sounds. It was all the federal agencies who had anything to do with tribal elders at all. And we would determine a topic for the year, and we would all work towards that end. I get to reestablish that federal interagency task force, which is going to allow me to start meeting with USDA and HUD and CMS and Blythe and all these people in one discussion to move this forward. So I think that's also a huge part of this whole planning process. As long as, you know, we're gonna approach LTSS from all kinds of different ways.
So, but the money, Cynthia, just to clarify, the money is for the resource center, not necessarily. We're not giving out money to a tribe to help them build something.
Correct. It will be for the resource center. So part of these very, very intelligent navigators that we're going to be looking for, one of their jobs will actually be to know where we can seek funding and to help steer the tribes to in those directions. So my part of this role is then to be working with feds and other agencies and to find funding sources.
Right. Exactly. Okay, so these resource centers would actually come under the Administration for Community Living, that they would fall under that.
Yes. Yeah,
that's what I thought.
Yes.
Okay. All right, that's excellent. That's excellent. Does anyone else have any other questions about that or comments for Cynthia while she's on the phone? Thank you. Thank you, Cynthia, for sharing that.
I can't think of a better steering committee for us planning this initiative than you folks. There's nobody that knows the LTSS world like you folks. We don't in Title VI. So I'm hoping I can really plan to have your involvement to help us put this together.
So will there be some, like I know we had that initial meeting with, at the hotel. Will there be more meetings? I mean, will you let us know? Will there be call-ins? Because I would, I'm sure many of us on the steering committee would like to be part of that.
Absolutely. And I'll work through you, Debbie, since you have the contact with everybody.
Okay, great.
Groovy, cool.
All right. Thank you very much.
I'll listen now.
And congratulations to Leslie also.
Thank you so much.
Yeah, wait till you see what's going to come out of this office now with two of us. Okay, thanks everybody.
All right, all right, that's fine.
Okay.
All right, so I'm gonna continue on with the standing agenda, and then it's 12:36 right now, so I'll have to just kind of keep moving. Let's see here. I'm gonna let me just look at this. There's not a whole lot with the GWEPs right now, I can tell you, because of my position changing with Archie Hendricks. The GWEP will no longer be funding Archie Hendricks with that. So that relationship there has ended pretty much. So we do still have, of course, the GWEP relationship with Dr. Jordan Lewis in Anchorage, just to be aware of that. I do think we need some outreach to our QAOs. I'm still in touch with Keith and with Lisa Johnson.
I'm here.
Oh, you're here? Lisa's on the call?
Believe it or not, yes, I joined you late, so I apologize. But hello, everybody, and I've been listening.
Okay, that's awesome. I'm so glad you're on the call. So I'm going to give you a chance to update us on your world here in just a second. I wanted to mention that we did, I mentioned the changes we're going to have with the steering committee, that we're going to meet twice. And I wanted to share with you a couple things on our annual meeting. So we did have our annual meeting. We had good attendance. I'm looking for that right now as we speak. We met on Tuesday night. We had a reception for the Title VI folks, and that went extremely well. We had some people come that, for example, Joseph Ray invited Dr. Robideau with National NCAI, and she came. I just sent her a follow-up email just this morning right before this meeting. So we're trying to follow up with some of the people that we connected with at our annual meeting. But we did have good attendance. We did meet. We were able, a group of us, a little different every day, but Tuesday, Wednesday, Thursday, we went over to the Senate Hart Building. We were able to connect with Tom Udall's staff from New Mexico, with Senator John Tester's staff from Montana, and also with Senator Murkowski's staff from Alaska. We actually got our picture taken with Senator Murkowski, so that was pretty cool. But those meetings went very well. It really isn't as scary as you think. I think it was an excellent experience for all of us to go and do that and to have that outreach. So we did get some evaluations, and I sent those to KAI so you can take a look. But I will say that one of the things that everyone really felt strongly about was our networking, getting to know others, being passionate about what we do, learning about other programs, and really being reminded about why we do what we do. So those were some of the things that we talked about for our next annual meeting. We did not pick a location. We talked about some possibilities, but it'll probably be, I'm thinking, probably in August of next year is probably what we're looking at. So we have those results, and then the thing that we decided at our annual meeting, and again, I believe the minutes have been sent out, is to formalize, is to take this group and really formalize it. So Susan White, who was at the conference with I think it's ACK Company Incorporated, she has agreed to help us with that process of forming like a tribal nonprofit. And I'll let Ron today talk a little bit more about that too. But that's really the direction we're going. So I'm committed to staying involved and helping get that established so that we don't lose the years of work that we've put into this collaborative. I think it's wonderful to see what's happened over the last 4 or 5 years. And I think often of Kay Branch and in the many years she spent in Anchorage. And I know that she would want this to move forward. So we're gonna do that. And Tammy Reed at Morningstar Care Center is very committed to continuing to co-lead this collaborative. So obviously anyone can contact or reach out to either one of us. So I'm gonna let everyone have a chance to kind of update us on their world. So Dr. Winchester, why don't you go first?
Oh, for the love of God. Okay, so one other thing that I didn't get to mention, and I don't know if you brought it up at the meeting, Debbie, is about the potential for a project that I-Reach at University of Washington would be doing on advanced care planning in facilities.
I mentioned it, but yes, we did talk about it, but you might want to go over that again.
Okay. So, the U.N.I.T.E resources are extremely useful in a lot of cases, and this is one of those times, just to even have the directory is super helpful for people to have an idea of how many there are and that sort of thing. The idea is that they'll be looking at a project determining what tools are used for advanced care planning in facilities, and can we develop additional tools that would be helpful? How do these vary across state and across tribes? Do people even do a lot of the advanced directives there? And are they on, residents who have cognitive disorders and not? Do we need a different one focused more on the patients who have cognitive issues? Are there any palliative care initiatives in your facility? So there are many potential, research questions. So I wanted to determine if there is interest in willing participation, that we think that if I helped collaborate with these people that we think our facilities would be okay with answering these questions and having, further questions asked about what those tools are that they're using and what might be more helpful and that sort of thing.
Okay. All right. And you're looking for basically any of our stakeholders or the tribal nursing home to basically talk to you? Do you want to do like an interview type of format? Is that what you're thinking?
Well, I think if there's enough interest that that the facilities think, yes, we think this is a good, because I know for mine, I think it's an excellent research question, right? I think it would be valuable for, my facility. And so I'm hopeful that other facilities will say, yes, actually, we would like to investigate, ACPs and what could be helpful. If there's enough interest, then that's great. And I think the next step would be Debbie trying to get you in on a call with the people from the U of A and have more of a discussion about the expectations and what's needed and that sort of thing, because it's very preliminary right now.
Okay. Is that the University of Arizona GWEF or?
No, this is U.N.I.T.E is the name of the group at the University of Washington. It's like Dedra Buchwald. I don't know if you.
Right. I think you did send me that, so I have that. Yep. I may have lost some of my emails, so just be aware you might need to send me that again to this new email, just so I have it.
Okay.
Okay. So U.N.I.T.E and University of Washington. So, should we put something into our U.N.I.T.E, newsletter to kind of, can we just say, press on this link if you want to leave your email to say I'm interested? Could we do something like that?
Absolutely. And that's why I'm mentioning this, because I know somebody with, more common sense than me would have a better idea of how to, garner interest in this.
So let's do that, because that's going out now to about 75 or 80 different emails. So we got a lot of people on that came out on this call. So Julie, are you, or Jonathan, you're still there, right? Let Jonathan.
I'm here. Sorry, I was muted.
Okay, let's see if we can get from Dr. Winchester some kind of an email or some kind of wherever she wants it to go, and let's get a link onto the newsletter that's coming out in October. And I can even type something up, like if you send me that, the link again to the iReach program, and just say, if this is something you as a stakeholder or your facility wants to be part of, that you're going to provide some information to these researchers, please click here. You know what I mean? We'll give them that option and kind of highlight it in our newsletter.
Okay, awesome. I'm writing the director of the project just to see, if she can send me a little blurb summary that would be better than what I can do. So I'll forward you whatever I get back from her about it.
Okay, that would be good.
That works.
Okay, and then we'll get that, and our deadline's that first Wednesday in October, so we still have a little bit of time. Do you know when they have to have this all by, Blythe?
No, I don't actually. I'm looking back through my emails, and no deadline's really been listed, so I don't know if they're just not, if I'm not worried about it because it's a ways, away, or what the,
okay.
I'll check on that,
right.
though.
Yeah, just double check on that so we give people a sense of timing. Okay, so I appreciate that update. Lisa, do you want to give a quick update on your world in Alaska?
Hi, I apologize. I've been unable to join the last few calls and the annual meeting, but we've had a lot of good work going on here in Alaska. I think most notably, we were able to partner with our state survey agency to secure CMP funds to provide some really great dementia training for our nursing homes. So what my personal goal was to have an embedded certified dementia expert in each of our 18 nursing homes, 3 of which are the tribal homes. And so we worked with our state agency to bring Teepa Snow's positive approach to care, which, if anyone is not familiar with Teepa Snow and this particular methodology and dementia certification, it's, as I say, it transforms care at the resident level. So very excited that we've been able to get this off the ground. We had 15 of our 18 nursing homes send somebody to this training. Our tribal nursing homes, we had 2 out of the 3. One of the nursing homes had sent somebody prior to the similar kind of training, so they didn't necessarily feel that they needed to send another staff member. In my opinion, that was unfortunate because that's money left on the table by the state. but we are now just starting to kind of operationalize this. And there have been some challenges with including the Alaska Native culture in this model of care. Just a quick comment that in our Alaska Native culture, you generally don't make direct eye contact with an elder at that first encounter. However, this positive approach to care really talks about the importance of the visual field and inviting people in. And so we've had to do a little bit of modification just to make sure that we are addressing some of the cultural components. But for us, it'll be ongoing work around including the culture as we go through this. And then I'm also still working with Dr. Jordan Lewis and a few others around some tools for culture and care at the bedside for each of the different types of Alaska Native groups. So that's what's keeping me hopping.
Okay, thank you. Dr. Lewis, by the way, was part of our presentation that we did at the Title VI conference. So there were 5 or 6 of us that presented, and he was one. So I think that went well. In fact, I'll send that PowerPoint out to everyone. If you haven't seen that, Jonathan, let's make sure we get that in the October newsletter. I'll send that to you. Great. Teresa, you want to give us your ombudsman report?
I don't know that I have a whole lot of new and interesting stuff happening.
Want to follow up with anything from our last call? And thank you, by the way, for sending, you and Lisa both, for sending that letter of support. We put that in the materials that we handed out at our annual meeting. So thank you both.
Great. Yeah, I don't have anything.
Okay.
I'll be training Teresa and her staff, though. That's kind of fun. I'll be doing the snow training for Teresa's group.
Okay. So just so you know, Tiba Snow is up here in Phoenix right now. I work with some, do some training with volunteers at a day program here called The Perfect Place in Sun Lakes, which is a Phoenix suburb. And I was talking to the director the other day, and she said that one of their staff went through this training with Tiba Snow. She's been up here at one of the senior living campuses here in Phoenix. So there's a lot going on with that. So thank you very much. Ron, did you have some follow-up on anything with sustainability or some stuff from this webinar we did in July?
Yeah, I'd just say that, the steering committee is going and exploring how to get more formal, like you mentioned, Debbie. I think that was kind of the marching orders we got from the annual convention. That's an exciting time. The information that you sent out was incredible. Very, very succinct and just conversation for the steering committee to try to figure out next steps. In our world, the Okolala facility was successful in, they had borrowed the money from the Shakopee tribe to build their facility, and the reimbursement for the Medicaid folks did exactly what we said it would do, and so then they were able to bond at a lower interest rate, and they paid off the Shakopee. The Shakopee was fine with that. That was not a problem. But they went out into the market then and was able to bond, and so that's helped the facility. But the facility is doing extremely well. Jump on their website, take a look at it, the Okolala Sioux Lakota Nursing Home. And then up in South Dakota, Rosebud Tribe made some progress with the state of South Dakota, perhaps not as much as we'd like, but those conversations are still going on. We were successful in getting them to amend their state plan with the CMS for their Medicaid for tribal residents, tribal facilities, tribal members in a tribal facility. That has been successful. And the state of South Dakota is saving hundreds of thousands of dollars because of our work. And now we're working with South Dakota to actually give the Rosebud tribe an enhanced Medicaid rate. I think we're getting there. I had another conversation with them last week. The Cheyenne River tribe up in South Dakota, hopefully after they get their facility up and going and they're close, I think we'll have another member for U.N.I.T.E. which would be nice.
Good.
And then we're just in the process of signing an agreement with the Kickapoo tribe down in Texas, and they're looking at building an assisted living facility. So we're going to help them from scratch, from, hey, this is a concept, to, okay, we're going to have a facility. And as Debbie knows, we've been working with the Archie Hendricks facility for a few months to work through the politics of the tribe in order for them to work with IHS, which is a prerequisite in order for them to approach the state of Arizona, for them to get the enhanced Medicaid rate. So that's in the works. We've talked to 3 tribes up in North Dakota. They're all going through their election process. So everything we've been doing has been put on the back burner, but it will come back up when I think the elections are over. So a lot of things happening, but we're excited about U.N.I.T.E moving forward, and then perhaps we can find some grant monies to get U.N.I.T.E off the ground where we could have a paid employee or two, because that's critical for any organization to move forward, to have full-time people like Debbie to help steer the boat.
So thank you, Ron. That's kind of where we are. That's what we've been talking about on the steering call. Shannon, did you want to share something because we don't get to hear from you too much, and we'd love to hear what's happening there in the Carl P. Curtis.
Same thing, different day. I'm just kidding. We opened our new facility back in July of last year, 2017. We're only at 25 residents, but right now, I think as of the end of the day, we should be at 22 for admin. As for me, just going through the motions, lots of tribal politics and whatnot, and we still have looking for a CDM if anybody's interested.
Okay.
We're also, you've been a remote community, and staffing is so important. I think we've spent probably over $500,000 on temp staffing agency throughout for fiscal year 2017 and 18, and it's becoming quite a concern with the council and the health center, because our health center picks up the additional costs and helps the nursing home fulfill the obligations for the nursing home. And yeah, it's quite challenging some days.
Mm-hmm. CDM is a chronic disease manager. Is that what that is?
Oh, no, certified dietary manager.
Oh, certified dietary manager. Okay, just double checking.
All right. So
yep. So there's lots of new things with infection prevention in nursing homes and trauma-informed care. Are you doing anything with the trauma-informed care piece?
No, we haven't yet. Our DON is fairly new, probably about a year and a half into it, and she's just been, with all the turnaround and lack of coverage, I haven't even been able to send her anywhere for her RN coverage and whatnot. So it does help for additional resources too, and it's crazy because we have several empty pieces in our building that are clinical side of the health center, the Carl T. Curtis Health Center. They don't fully understand what we have to do to. They're trying to put different services in our nursing home, and I'm like, no, you cannot do that. And because we have had a turnover rate in our CEO, I think, too, the past year. So it's challenging. So challenging.
And I want to remind everyone that that's what this U.N.I.T.E Collaborative is about, right? We want people on the calls and participating so we can hear about this, right? So we can, support each other, even if it's between calls, right?
Yeah.
Mm-hmm.
But other than that, it's day to day, take care of our elders.
Mm-hmm.
And I just got my social service designee too, so I'm going to be carrying all these titles with me.
Well, congratulations.
Yeah, certified dietary manager school next. So that.
Well, I hope you.
And it's hard enough. You would think one of your staff would, and hope and pray that they would step up and say, "Send me to school," because we offer that, we can pay for that, but nobody wants to take that initiative.
Yeah, I had set that up for our dietary manager at RT Hendricks to get that certification. So it's a little bit chunk of work. I think it was about 11, CEUs or contact hours at the local community college. I think it was 7 or 11 units. So.
Yeah, and North Dakota has a good CDM program. I think it's only like $700 tops for a whole year.
That's
and it's all online, so. And
it's for working professionals. It's designed for people who are working. Yeah. Yeah, which is really important. So I want to just mention that at the annual meeting we did pick as our clinical topic the idea of the young elders in the tribal nursing homes caring for people with addictions and trauma, which is huge right now for CMS. I'm sure you're all aware. And in our non-clinical topic, we're going to continue to promote tribal nursing homes, keeping elders close to home, enhanced Medicaid rates like Ron was talking about, and getting CMS and states working together to benefit tribal elders. So that's what we're working on. So those will be very consistent with what we talked about today on this call.
Yeah, and that's what I had a hard time with our tribal council is getting our cost report in. The tribal council not quite understanding that piece of the nursing home and getting those bids and whatnot for our auditors to do that cost report, and it took a long time to understand. And I was like, this is additional money that we get from the fence side, and I had it tabled twice because they didn't want to pay the auditor fee,
So I don't know, Ron, if you guys know each other, right? You and Shannon have worked together. If that's possible.
We were successful a few years ago of getting the Omaha tribe over $3 million back enhanced Medicaid, and we were instrumental in helping the Omaha tribe with getting the money to do their renovation. So, Shannon, I need to come up and talk to you and see what's going on and see what we can do to help you.
Okay. That's great.
Ron, also, this is Blythe. If you're working on that process from the ground up for somebody else, I don't know if there's somebody who's helping you can kind of document that process. That would be so super helpful, even if it's just looking at, the barriers you encounter or whatever that sort of thing is. It would be really fantastic.
Blythe, it took us 9 years to build the facility for the Pine Ridge Reservation.
Also so helpful to know, right? I mean...
Yeah, it was a journey.
Nobody gets discouraged here. But I appreciate that. I appreciate that, Blythe, because I think you're right. When we're in the midst of it, sometimes, we forget to take notes.
Well, right, 9 years ago, it might be hard to remember what was happening at the beginning, right? It does take a long time.
Right. So if you guys will send me thoughts as you go along, just send me a quick email. Say, Debbie, here's something. Let's start gathering those. I'll start creating like a little journal. And we can use that. We can use that when we apply for money to say, these are the barriers. And this is why we need this funding, is to help us overcome some of these barriers. So it doesn't take us 9 years to build a nursing home. Right?
Yes. Thank you, Debbie.
So just use me as your point person. I hate to say I have time because, as usual, I'm already doing a million things, but I do. So I will make time. So I want you to send me those little thoughts that you have, things that happen, stories. Just send me a quick email. I'll create a file. We'll start keeping a log of them, and we'll use them. We'll use them when we apply for money to make our point, to make our story. So that's how that works. It's helpful. Okay. So I guess that's about it. We're out of time. It's 1:02. I'm sure there's other things we could talk about. Our next call will be in October, So just as a quick reminder, we've got our deadline for the newsletter for October 3rd. We've got our steering call on the 8th and the 22nd, which are Mondays, and then our regular monthly call in October will be Thursday the 18th. And I believe in October will still be a 3-hour time difference. So those will all be 3 o'clock Eastern time, 3 o'clock Eastern time.